Yeah, what brings you into the emergency room? Heard you're having some difficulty breathing, right?
Yeah.
Okay. So I noticed when I was looking over your chart that you were back in here about 3 weeks ago for a procedure. You had a TAVR. Okay, I just wanted to ask how you've been taking your medications. Have you been taking those blood thinners that were prescribed to you?
Sometimes, and sometimes I don't.
Sometimes you
Forget,
don't.
yeah.
Okay. So what I'm gonna do is I'm just gonna do an assessment on you. We're gonna get you all squared away. First of all, we're gonna check your oxygen with the pulse oximeter. So let me put that on. All right. Looks like we're at 84, so that's pretty low. Have you've been having some shortness of breath? Let me grab some.
Yeah.
I'm gonna grab some some oxygen for you. So I'm just gonna put that on. That might help you breathe a little better. We're gonna start that out with 4. So I noticed you have a history of COPD, right?
Yes.
So you've had this cough before, maybe sometimes.
Always.
We're worried that, we are worried just it's an exacerbation of that, but maybe we just want to make sure there's nothing else going on. So I'm gonna listen. Okay. Okay, now I'm gonna listen to the back of your lungs. Make sure there's nothing going on back there. Alright. Definitely have some congestion going on there. I noticed some crackles just by base of their both lungs, and I also noticed some wheezing. So let me real quick I'm gonna check how your oxygen's going to your body. Okay. We do have good cap refill right now. Do you mind if we got your boots on? I'm gonna take them off if that's alright.
Sure.
We'll get you in a hospital gown, but I'm gonna just check your feet and see how you've got okay, thank you. Sorry. Let's see. I'm gonna check your pulses down here. I'm gonna check your refill. Okay. Refill's a little slower than, definitely greater than 3 seconds. I'm gonna feel your pulses up here. Okay. I'll give my fingers a squeeze as hard as you can. Okay, good. Okay, and then I'm just gonna check your. Okay, I do notice that you got some jugular vein distension. That could just do with fluid like having too much fluid in your body. Now, one thing we're gonna want to do with COPD and with possibly some other things, we just want to make sure that we're limiting your fluid amount. So
Okay.
don't drink any fluid. I'm gonna take your water bottle away. It looks like you don't have one. That's good. So we're just gonna limit that, especially while we're here in the hospital.
Okay.
And they're gonna probably start you on some Lasix or something like that. I'm gonna listen to your heart. Okay, I've got S1, S2. You can hear your heart is beating pretty fast.
Yeah.
I'm gonna feel your pulse and and we can look up on here on the monitor. We're at 114, so your pulse is definitely beating fast, trying to get, it might be struggling with that COPD to get your blood through your body. So let's see, I wanted to ask you about, I know you have a history of kidney disease as well.
Yeah, I do.
Yes, so how's your pee been? Have you been able to pee recently or?
So I have the sensation of going like very bad.
Okay, you have like that urgency.
Yeah, but when I go, it's like a few drops and it hurts a lot. So,
Okay, hurts a lot. Is there a lot coming out or?
just a few drops.
Oh yeah.
It's not much, but I just have like the urgent to go every time. I don't know.
Okay, so you've got that urgency. So with kidney disease, I know that they're trying to figure out a way to help you with that. They did put in this fistula on your left arm, so that's a place where they brought a vein and an artery together, and they're planning on doing dialysis, but it takes a couple weeks. So I'm gonna listen to that with the bell of my stethoscope and make sure that that's still intact. We don't have any redness or swelling, so that's a good sign. I'm noting the bruit and thrill. It sounds good. It is present, so those take 2 to 3 months to mature. So you did get it a little while ago, so the doctors are going to come by and assess that, and if they need to, they can do some dialysis, and that might help with your fluid volume overload, but it will also help with your bladder
Okay.
too.
Sounds good.
We're gonna take labs. We're gonna do a CMP, which is this is the doctor saying this, but I'm just their nurse. But he wants to take a CMP, and that's gonna determine what your electrolytes are like, and then also we're gonna take a CT. So I'm gonna go out and get those prepared. We're gonna get you squared away for that. And we're gonna just see what we've got going on there. It'll kind of tell us what's going on with your lungs. So I'm gonna go get that ready.
All right. Sounds good.
Okay.
Thank you.
And we've got that done. So that CT, so we just completed that. We noticed your electrolytes are off. Your sodium is, it's hot, it's low, and your potassium's high. So what we're gonna need to do is we're gonna have to try and get some of those fluids to go off. And your potassium's high, so we're gonna wanna use something like Lasix, which is a diuretic. It's gonna help you pee. And I'm just gonna do the rest of your assessment. I'm gonna listen to your abdomen. Okay. Abdomen does sound normal. Junior, I should have asked you this at the beginning, but do you know your name and your date of birth and where you are?
Yeah.
You're
You know,
Maria, right?
Maria. My date of birth is August 22nd,
Okay, sounds good. What year?
1995.
Okay, great. That's good. And then let's just lift. I'm gonna just close your eyes. I'm gonna test your sensation real quick. So you feel that?
Yes.
You feel that? You feel that?
Yes.
That?
Yes.
You do it down on your legs. You feel that?
Yes.
Okay. You feel that?
Yeah.
And that?
Yes.
Great. Your sensation looks good. Let's lift your hands up against my hands. Lift up and then push down. Okay, great. And now I'm gonna drop my hands and you just keep them up, okay? Okay, great. We're gonna do the same thing with our feet. Lift up. Okay, great. Lift up, pull down. Great. And then keep them up. Okay, great. You're good. Okay, let me think. So that CT showed that we have something called pulmonary embolism going on. So we're worried it's a little bit of just, we were worried it's just a COPD, but that shows that we've had some sort of like embolus or a clot that's come up from your legs and gone to your lungs and kind of just saddled right around where your lungs break in your bronchi. So, were you laying for an extended period of time before you came in?
Yes, I was.
You're recovering from that TAVR, right?
Yes.
And then you didn't take that
No.
anticoagulant. So that's going to be something very important, is the anticoagulation. It helps to prevent blood clots from moving, and break them down, but it also is going to be something that we're going to be starting you on, is that anticoagulation. That's something that's very important. It really needs to be a top priority for you. While you're in the hospital, we're going to be monitoring your oxygen status, and then physical therapy and occupational therapy is going to work with you, as well as respiratory therapy is going to keep a close eye on you. I do have this education for you. We're gonna, so this is pulmonary embolism. They're just our hospital resources. This is just kind of the condition and what we need to change. So pulmonary embolism, can occur from just having venous stasis, and then obesity, high blood pressure can cause it. So we've got one right here in the lungs. So we're gonna keep monitoring your heart and your lungs with that. We've got heart failure. You do know about this, but we really need to make sure that we're following a DASH diet. So that's a diet. It stands for Dietary Approach to Stop Hypertension. So what you're gonna really need to focus on is we're gonna be eating vegetables and fruits, low sodium, low fat dietary products, whole grains, fish, chicken, low fat stuff. So we're gonna wanna try and lower our blood pressure, because your blood pressure was elevated, and you do have a history of that, but we need to make sure that we, and then also you've got an increase in weight. I noticed that you've gained greater than 10 pounds in the last 3 months, and the good news is that's not just from eating bad, although that can cause it with the high sodium. It's from fluid, so you have a lot of fluid overload. One thing I did notice with your feet is that you had really quite a bit of edema, and I'm pretty sure you noticed that too. That swelling. And you had that swelling in your arms too, just kind of generally, but down here it's pretty prevalent. It's like 3+ pitting edema. So they're gonna want to get that fluid off, so they're gonna start you on Lasix and try that out, see if they can get you peeing. And if that doesn't work, they may place like something like a temporary dialysis catheter, or they might use your fistula if that's available, to pull off that extra fluid. So this is that pulmonary embolism. With your heart failure, just that DASH diet, and then we're gonna want to elevate these extremities while you're laying down. And then we're just gonna put you on a sodium restriction and a fluid restriction. Here in the hospital, that'll be a cardiac diet. So it's just gonna be a diet on the menu, everything with the heart. That'll be something that you can eat. This isn't a chronic thing that you've been dealing with, but this is it getting worse. And then this is kidney disease. So you've been in stage 3 for the past little while, and we've tested your glomerular filtration rate, and it's gone below 15. You're not having your kidneys aren't really working that well. So we're gonna wanna, that's why we're also gonna do.
Is this why I have to go and use the restroom, like pee all the time?
Yeah, that urgency, that's probably mostly due to your kidneys, and it could be your sodium too, and it could be worsened by that congestion you have with your heart as well. So we're gonna keep treating you with your normal medications for that, but as well we're gonna try and get dialysis started. So we did test your urine as well, and it had albumin in it, which is a protein, so that kind of shows that we're having, that's something that you've had in the past too. So this is kind of dialysis. You know that they'll put this, a couple of things in your arm, into your fistula. It's going to take the blood out, filter it, and then bring it back in. So let me go check something real quick.
All right, thank you.
All right, thank you. That has been all.
Thank you.
I
Nice
appreciate
to
it.
meet
We're
you.
gonna get you all set up.
Right.
Thank you.
you.